Welcome to this Health Evolution interview. Joining us today is Justin Dearborn, CEO of PatientBond. Justin, thanks for joining us today to discuss consumer science and patient engagement. As a first question here, PatientBond offers a patient engagement platform and employs a scientific approach. What does that mean, and what is consumer science?
Sure. So consumer science really involves using disciplined methodologies to uncover meaningful insights regarding consumer beliefs, their needs, habits, motivations, and understanding really how consumers interact with their environment. And in this case, we're talking about a healthcare ecosystem. And in order to have the deepest consumer insights, you really need to build a psychographic segmentation model, which requires well-drafted and really extensive primary market research. And at PatientBond, we have a proven psychographic segmentation model that now includes several hundred million data points collected from tens of thousands of people over 8 years on health consumer attitudes and behaviors, which then forms the basis for our scientific approach. And really is the reason why our model has been so successful in a large variety of patient and member applications.
Which is a nice way to set the stage here. So advancing it a little bit, how does PatientBond actually leverage consumer science to drive engagement?
Yep. So we use consumer science known as psychographic segmentation, as I mentioned, which groups the target healthcare consumer into different categories according to their attitudes, their values, their personalities, and their motivations. And this really goes beyond demographics. So recognizing that the same people, the same age group, gender, ethnicity, or even health condition do not act and think the same way. And so we use a healthcare consumer psychographic profile to personalize digital engagement, content, channel, or modality mix, and the frequency of those communications to really resonate with the individual, thereby motivating and activating desired healthy outcomes.
And where do PatientBond's engagement efforts truly begin?
Sure. We have a 5 psychographic segment model, as I think I mentioned, and each segment approaches health differently and requires a different engagement strategy. And we have several ways of identifying the healthcare consumer psychographic profile. The first and the most accurate results are our 12-question classifier. So depending on the relationship our client has with their member or patient, we ask them to do a 12-question classifier. It takes about 60 seconds. It doesn't involve PHI. It really gets to your attitudes and behaviors and personality. And it's about 500 questions boiled down to 12. And then we extrapolate from there. We also have a progressive classifier, which starts with 3 questions and is 3 times better than random chance of assigning a segment. And this questions can be added over time, 3, 4, 5, as our clients get more comfortable with asking their patients to remember to answer one more question, and that improves the accuracy of the model. And we've also pre-segmented the entire US population over age 18 using a statistical projection model through machine learning, and we're working with a national data compiler partner on that. And we can immediately append a healthcare organization's patient database with segments to get started immediately.
How does all that enable you to move beyond a one-size-fits-all approach for patient engagement, or what I should say, patient engagement or member engagement?
So once we know a patient or a member's psychographic profile, we can use insights and data about their values and their priorities to develop communications that really speak to them personally and motivate desired healthy and positive behaviors. And again, there's 5 segments, each with a different optimal engagement strategy. And so a one-size-fits-all approach might appeal to 1/5 of the audience, but fall flat with the other 4 segments, or 80% of the population, and potentially alienate a portion of the population as well. And we've used this approach to achieve enhanced results for our customers, whether it's for marketing and patient and member acquisition and loyalty, or for clinical applications, or to improve health outcomes. Think about care gap closures or readmission programs or condition-specific messaging here. And lastly, with some revenue cycle management efforts to facilitate bill payments.
And you mentioned achieving some results in there. Can you tell us a little bit more about those? What specifically might surprise executives who aren't necessarily familiar with consumer science?
Yeah, so this is what really got me excited when I looked at the company, the results we have in the use cases. So in marketing, we've seen a 50% increase in converting patients to in-network primary care from frequent ER visitors. We've increased telehealth registrations by 7x. We've increased Google reviews, which is the main form for reviews in urgent care, upwards of 30%. For health outcomes, we've seen a 90% reduction in unnecessary hospital readmissions for conditions such as congestive heart failure and COPD, 8x response among members signing up for health screenings, which is an important metric for health plans and Medicare, Medicaid. 30% increase in health risks for patients receiving health coaching, a reduction in health risk for those receiving coaching. And the rev cycle side, 4x increase in patient payments and a 25% increase in collections, and overall 50% reduction in paper statement and postage costs, which is a big expense for a lot of the high volume clinics we work with.
Sure. And now moving forward, how do you see consumer science evolving? What should executives be thinking about today to prepare for the future with more consumer science, presumably at least?
Yeah, there's a need for more focus on consumer insights and behavior economics. This includes mapping patient and member journeys at each stage of healthcare process, from shopping for care through receiving care to paying for care, and ensuring patients return, and really all in a more efficient labor manner. Healthcare also needs to look kind of beyond its own walls. Patients or members generally spend 5% or less of their time kind of interacting with healthcare providers. And healthcare is sitting in some cases with a lot of data, but consumers don't really, aren't focusing their everyday on really that portion of their life. It's really less than 5%. So thinking about how much consumers spend, thinking about healthcare really and maximizing that time. And we believe that by merging healthcare historical and claims data or other forms of consumer data, such as social determinants of health data, with the psychographic segmentation model we do, can really provide a 360-degree view of a healthcare consumer and drive a lot of great results. And lastly, I think we'll evolve to true one-to-one personalized and automated digital engagement. Psychographic segmentation is a big and really necessary step in achieving this. So bringing together healthcare and other consumer data at the individual level will really enable extremely powerful engagement with less manual human intervention, which is becoming more and more important as clinical labor shortages become more pronounced.
Well, this has been great, very informative. So thank you very much for joining us today, Justin.
Thank you.